Platelet-rich plasma, or PRP, is made by taking blood, spinning it very, very fast, or centrifuging it, and then extracting this part here. This juicy part contains many, many platelets, which contain many growth factors. And really, PRP has been used for many years in the hair loss industry. Research whether PRP actually boosts hair growth is really quite mixed. My overall impression of PRP is that it is not a significant needle mover and will never compare to the likes of the FDA medications like finasteride and minoxidil, which are proven to cause hair regrowth. In other words, you'll see most of a difference on these medications. Also, PRP is unlikely to ever be able to compete with something like a hair transplant, which is a permanent solution and the only permanent solution to hair loss that we currently have. But a question that I want to answer in this video is, can it be used as an adjunct or an add-on therapy alongside a hair transplant or after a hair transplant to boost or improve the outcome of that hair transplant? Now, this is my second video in my new video series where I take a deep dive into the research so that you don't have to on certain medications and therapies to see whether they may benefit a hair transplant result in the end. This is so that you can get the most growth possible from your hair transplant and therefore the most bang for your buck. I want to go through whether PRP can achieve this. There is some promise that I was able to find through research papers on the topic, and I think the first one that I want to talk to you about is this 2006 paper titled "The Role of PRP in Male Pattern Baldness Surgery." Where essentially 20 male patients with male pattern baldness were selected. Researchers demarcated 2 squares on each patient's bald scalp. You can see both squares were the same size, 2.5 by 2.5 centimeters. And in the left-hand side square, they implanted hair grafts that were basically bathed in platelet-rich plasma. And on the other square, they implanted grafts that were untreated and used that as a control. This was done in every patient, and the number of grafts that grew in the end, comparing the left-hand side square and the right-hand side square, were compared. The overall conclusion was actually that they found a considerable benefit to the graft yield between the PRP squares and the non-PRP or control squares. And what was actually seen was an average of 15.1% more growth in those squares containing grafts that were enriched with PRP. But the main 2 limitations to this study that I can see is, first of all, 20 patients is not a lot of patients. Ideally, I would like to see more patients in any study. And the other thing was that it was not double-blinded, meaning that both the doctors and the patients knew which square contained the grafts enriched with PRP and which square contained the grafts that weren't. And so in the end, even though doctors and the surgeons, I imagine, were trying their utmost best to not be biased and to not count or accidentally count more grafts during the assessment or the counting process later on, there's always going to be the possibility of bias when the doctor knows which square is the treated square and which isn't. There is a later study titled "Alopecia and Platelet-Derived Therapies." This was 6 years after that previous study. And here, what was different was that not only PRP was used, but something called PL was used. And PL is platelet lysate. Platelet lysate is made similarly, but slightly differently. Now, platelet-rich plasma, as we said, involves taking a blood sample, spinning it very fast, and that kind of separates the blood into its components, and then we take that specific section that is very rich in platelets. With platelet lysate, we do the same thing, but we do one more step on top of that, which is that we take the platelet-rich plasma and we do one of these following techniques to it. We expose it either to ultrasonification, or we might add calcium gluconate, and what that does is it lyses, or it breaks the platelets up. It kind of bursts the platelets, and when the platelets burst, they basically release their growth factors. And so in a way, researchers will argue that platelet lysate allows the tissue to soak up those growth factors easier because the cell membranes of the platelets have been broken down and they've released all those juicy growth factors. So actually, treatment zones with platelet lysate, PRP, and just as a control with saline were used. So you can see here they used 3 patients, and on each patient they had 3 treatment zones which contained platelet lysate, PRP, and saline as controls. And really, after 4 months, interestingly, 99% of the follicular units that were implanted with platelet lysate were found to have grown, whereas only 75% with the PRP and 71% with a saline group grew after 4 months. This suggests that the platelet lysate and the PRP have improved the growth of the grafts in those treated regions. The authors believe that platelet lysate may initiate those hair stimulation pathways more effectively than PRP, since the platelets, as we said, said, have released their growth factors because they have been burst. The overall conclusion was that given that there was a 28% increase in the growth of grafts with the platelet lysate compared to the saline, that platelet lysate should actually be investigated or further investigated as a possible side effect free adjunct or add-on to hair transplant surgery that may improve the overall result. So what's my overall impression? Well, what I'd say is that PRP shows limited regrowth of hair when used alone. But in combination with a hair transplant, it's possible that PRP could boost hair regrowth by 15 to 30%. And this could be the difference between a good or a bad result from a hair transplant. But certainly more study is needed, and specifically with more patients, and to make sure that those future studies are double blind so that we exclude any bias. And I also think it's not an unreasonable suggestion to look into platelet lysate as a alternative to platelet-rich plasma that could have further beneficial effects. And with both platelet lysate and PRP, this is something that myself and Dr. Bloxham may consider doing some research on. And if there are any other hair transplant surgeons out there that wish to do the same, the more the better, really. Thank you so much for watching, guys. I'm Dr. Paresis once again. I work in London, UK, in partnership with Dr. Feller and Dr. Bloxham in Great Neck, New York. See you in the next one.